Good afternoon. Welcome all the delegates, all the IMA leaders of our nation and our state IMA, and all the guest faculties, members of our Indian Medical Association. So warm greetings from IMA AMS, Academy of Medical Specialties. So welcome to this monthly webinar. So welcome to all. So this is the program agenda today. We have three eminent speakers and two moderators doing this wonderful session. Mainly the first topic is human papilloma virus vaccine, HPV vaccine, and second session is the World Mental Health Day commemoration. So we have a wonderful talk by the eminent psychiatrist from Chennai. So this is the brief program agenda. May I request our Joint Secretary Dr. Adar Sindal Kumar for the physician's prayer and IMA prayer.
Thank you, sir. Very good evening, one and all. Physician's prayer. Dear Lord, thou great physician, I kneel before thee. Since every good and perfect gift must come from thee, I pray, give skill to my hands, clear vision to my mind, kindness and sympathy to my heart. Give me the singleness of purpose, strength to lift at least a part of the burden of my suffering fellow man, and a true realization of the rare privilege that is mine. Take from my heart all the gold in worldliness, that with the simple faith of a child I rely on thee. I am a prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Thank you, sir. Thank you,
Sundil sir. Now I request our chairman of IMA AMS TNSB, Dr. V. Rajesh Babu sir, for the welcome address. Dr. V. Rajesh Babu sir is a senior consultant neurosurgeon and head of the department in Ganga Hospital, Coimbatore. Dr. V. Rajesh Babu sir is a former president of IMA Coimbatore and currently is the chairman of Organ Donation Committee as well as the Academy of Medical Specialties. Over to Rajesh Babu sir for the welcome address.
Good afternoon, everyone. I welcome our president, Dr. P. Senguttuvan sir, for this CME, which is being conducted consecutively for the 10th month in this year. In spite of his busy schedule, he is able to attend the meeting. I welcome you, sir. And at the same time, I like to welcome our State Secretary, Dr. Karthik Prabhu, and our National Vice Chairman of the IMA-AMS, Dr. V. Amudan sir. And I'd like to welcome our State President-elect 2025, Dr. B. Sridhar sir. And I'd like to welcome Dr. Abul Hassan sir, the immediate past President, and our Honorary Secretary of the IMA, Finance Secretary of the IMA TNSP, Dr. Gauri Shankar. Today, this meeting we are having with the national people. They wanted to talk about the HPV vaccine. So we included them also. And also we are having this month the World Mental Health Day program. One of the speakers, the psychiatrist from Chennai. I welcome the speakers of the day, the Sabana Sultana and Sabista Patel and the Sweta Raghavan. And I also like to welcome the moderator, the Sujatra Rajendran, and Dr. Maithili from Keelpark Medical College. See, this HPV vaccine program is going on in this year since January, and a lot of programs have been conducted, and the awareness has to be reached to the great level. That is a very important thing, and even our national and the states office bearers, and also the minister and the chief minister, all people are trying to include this HPV vaccination also in the vaccination schedule. So it is a welcome move by our Indian Medical Association, state, national. Both are thriving together and doing it. I welcome the speakers of this day today. And at the same time, I welcome our past National IMAMS Chairman, Dr. Namita Gupta, Madam, who has joined the program. I welcome you, Madam. And the message to our members of the IMA Tamil Nadu is that next month we are going to have a National IMA-AMS conference at Chandigarh. I invite all of you to please register for this national conference, and also register for the FIAMS, the Fellowship of the Indian Academy of Medical Specialties. For the program, this certification, they need to register. I invite a lot of people to join in that program to get the degree. And also, I invite more of the people who are joined today to become, those who are not become the members of the IMAMS, please register yourself as the IMAMS. Thank you, one and all. I welcome you all for this nice session. Thank you.
Thank you, Chairman Sir, for our wonderful felicitation and welcome address. And may I request our State IMA TNSP President, Dr. P. Sengutun Sir, for the presidential address and start the same program. Over to our IMA.
Thank you, Dr. Jayaraman. Thank you, Dr. Jayaraman, for inviting me this mega event HPV vaccination program. Respected immediate past President Dr. Abdul Hassan, respected President-elect Dr. Sridhar, respected Honorary Secretary Sri Karthik Prabhu, Gauri Shankar, Finance Secretary, and AMS Chairman Dr. Rajesh Babu, Secretary Dr. Jayaraman, Adar Sendil, and National Coordinator Dr. Bhagani Nikam, and other national leaders. Good afternoon to everybody. I think HPV vaccination program has been launched very seriously, and our Tamil Nadu people is getting trained. So many people are trained. Dr. Priya Kannan, who is in charge for this HPV vaccination program for the Tamil Nadu state, and he is engaging all the activities regarding this. So today's speaker, HPV vaccination and problem and everything, they are the leaders are speaking. I welcome all the leaders and speakers of the day. Thank you. Best wishes to the team. Over to Dr. Jayaraman.
Thank you, President Sir, for your wonderful felicitations and other recent updates and all. So thank you. Now I'll give my Secretary's report of the IMA-AMS last month activities. This is our team of IMA-AMS Tamil Nadu chapter. Dr. V. Rajesh Babu Sir is the chairman, myself, Dr. Jayaraman, secretary, and Dr. Adar Sendil Kumar is joint secretary. So this is our national IMA team as well as the IMA-AMS state and national team. I welcome all the leaders and the immediate past chairman of our IMA-AMS, Namita ma'am, welcome to this program. All the leaders of IMA, welcome to this monthly webinar program. So last month we had wonderful activities to start with our monthly webinar to commemorate World Lung and World Heart Day. So we had a wonderful discussion about the end-stage lung disease and lung transplantation, so pulmonary perspective, and we had a heart failure management by eminent cardiologists from Chennai. So we had a wonderful 3 days international conference on sleep disorders. This is IMA-AMS is one of the partnering academic partner. So we did a wonderful participation, IMA-AMS and CSM, Southeast Asian Academy of Sleep Medicine. Commonly, we did the 3 days international conference on sleep disorders with the 6 CME credit points from Tamil Nadu Medical Council. I thank our President, Dr. Sengutun Sir, and all the leaders of our IMA National. So Sengutun Sir joined as a guest of honor in our 3 days international conference and felicitated and inaugurated our conference. And this was the inauguration of our Southeast Asian Sleep Medicine Conference. And we had a fellowship award to all the eminent sleep specialists in the world, throughout the world. So in this program, our Professor Garun Hamilton is the president of Australasian Sleep Association, joined from our as one of the chief guests, and our Dr. Sengutun Sir joined as a guest of honor. So we had a wonderful fellowship certificate distribution program. This was the fellowship of CSM program. The last month we had a wonderful activities. And AMS Coimbatore now being connected along with the Neuroscience Forum of our AMA. So we had a wonderful program at Coimbatore. This is a webinar program. And we had a World Lung Day. So myself, Dr. Jayarama, as a pulmonologist, I did a World Lung Day commemorative program, Facebook Live program, and general public awareness talk about the air pollution and what are the common diseases, how to prevent, and about all the ramifications of the respiratory perspective. I delivered all the World Lung Day commemorative talk. I welcome everyone to join our IMA AMS conference. This is a national conference, UMSCON 2025 at Chandigarh on 29th and 30th November, Complex Sector 35B, Chandigarh. This will be annual conference of Indian Medical Association, Academy of Medical Specialties. I welcome to join in this mega event. And in the IMA AMS, we have more than 45 certificate courses, short-term courses, all for our IMA AMS members. Those who want to join, kindly join in these type of courses. This is a 4-month, 6 months, and a 1-year course are available now. This is a kind of laparoscopic IMA course now available in Chennai as well as in Coimbatore, and diabetic retinopathy course and infertility course available in Coimbatore, and orthoplasty course in Coimbatore, and regenerative medicine course, this 6 months course, and a 1-year course at Trichy Maruti Hospital under the directorship of Dr. Ravi sir. And we have in Chennai MGM Healthcare, we have Sleep Med IMA, Sleep Medima, this is a 6-month short-term course. So I am the course coordinator, and this is all the course application form fees. This will be a 6 months course, all the Sundays, both online and offline, alternate course. This course fee will be 35,400 rupees, including GST. This is a critical IMA course in Coimbatore Royal Care Super Specialty Hospitals, and we have in the hospital digital course also available. With that, I conclude my talk. I request our national leaders for the felicitation. May I welcome our IMA AMS headquarters chairman.
Sir, one more thing, sir.
Please, sir.
In the report, one more thing I like to add, sir.
Please.
We have conducted one program by name Eye Donation Program. That is the retrieval of the eye. That is the program which is conducted from the Sivagasi IMA branch to increase the eye donation campaign. That is the thing which we have created in Tamil Nadu, a unique program which is being created from Tamil Nadu IMA. Last month we have conducted in Coimbatore on 30th August, and this month on 21st September we have conducted the program to give education about for the medical fraternities and the ophthalmologists to give the eye retrieval. That is the program which we have done, and that we need to add in the reports we will add in future. That is a unique program that is can be taken up as a national project that we are going to discuss with the national president. Thank you, one and all.
Thank you, sir. Now I request our chairman of IMA AMS headquarters, Dr. Ramneet Singh Bedi, sir, for the felicitation. May I request our IMA AMS headquarters vice chairman, V. Amudan, sir, for the felicitation. Amudan, sir. Unmute your mic, sir. Sir, please unmute your mic, sir.
Yes. Good evening, respected President IMA Tamil Nadu State Branch and members of IMA AMS Tamil Nadu State Branch. I am happy to have this wonderful session planned on HPV vaccination, and today is a very important day for them. Now we have got the annual conference in November 29th, 30th at Chandigarh. I request all of you to join the annual conference, and we are bringing out an annals on this occasion. And I have written a chapter on echocardiography for adult human vaccination in that. I will share with you the transcript of that in our Tamil Nadu state as well as in the national area. The most important thing is adult human vaccination is not a light. You should not take it as a light thing. First of all, patient has to be assessed. That is a point which I have to stress here. Whatever the adult human vaccination, just do a clinical examination, just check the blood pressure and take a normal ECG. If everything is normal, you can take the patient for adult human vaccination. If you feel the patient has some problems in the chest, in the auscultation or in the ECG, you have to do simple cardiac echocardiogram. Transthoracic echocardiogram is essential, where cardiac functions, both systolic and diastolic function, as well as the assessment of the valves and other chambers have to be assessed. This is a very important point. I've written an article on this in the annals, and the flow chart I have given there. So prior to vaccination, please do a cardiac examination. If there is a problem suspected, please don't shy away from a cardiologist's opinion. Otherwise, you may end up in trouble. So with these few words, I wish the whole session all success. And Tamil Nadu State Branch is doing very well. And I wish Tamil Nadu State Branch to get the Best Chapter Award this year also. Thank you very much.
Thank you, Vice Chairman Amudan sir, for your wonderful felicitations. May I request our IMA AMS Honorary National Secretary, Dr. Sairam sir for the felicitation. Okay, may I welcome our IMA State Honorary Secretary, Dr. Karthik Prabhu sir, our State Finance Secretary, Dr. Gauri Singh sir, our IMA Immediate Past President, Dr. K.M. Abul Hassan sir. May I welcome our President-elect 2025, Dr. B. Sridhar sir. Okay, they may join at any time, and with that I conclude this my secretary's report.
Amita madam to give.
May I request immediate past chairman of our IMA AMS headquarters, Nomita Gupta ma'am, for your opening remarks, ma'am. Nomita Gupta ma'am. Dr. Nomita Gupta ma'am. Sindhil sir, please check, madam is there?
Yes, sir.
Nomita ma'am was here sometime back. I saw her.
Okay, ma'am. Okay.
Yes,
No
yes,
issue.
yes, yeah.
Okay. No issue. We'll start our CME program. May I request our Joint Secretary, Dr. Adar Sendil Kumar, to take over and start the start the session with introducing the topic and the moderator, and hand over the mic to other speakers. Over to Dr. Sendil Kumar, sir.
Yes, sir. Shall I share the screen?
Yeah, I will stop my screen.
Okay.
I will. Yeah, now you can share your screen, Sindhil sir. Sindhil sir, yeah, right.
Okay, sir. Screen is visible?
Yeah, make it the full screen.
Full screen only, sir.
Okay, fine. Proceed. Yeah.
Okay. So, very good evening. We welcome all of you for this wonderful CME. Today we have two sessions. One is with the HPV vaccination and another for the mental health day. And yes, sir. The first topic is the debugging myths about the HPV vaccine. We have two moderators, Dr. Sujata Gajendran from Syrian Consult Obstetrician and Gynecologist Women Health Wellness Center, and one another moderator, Dr. Maithili. She is civil assistant surgeon and consultant psychiatrist, Kilpauk Medical College. Moderator, madam.
Yes, sir.
Sir, yes,
Yeah.
Kindly introduce our speaker, Sabana Sultan, madam. The screen is there.
Yes, sir. So, good afternoon, one and all. It's a nice experience and opportunity for me as a gynecologist to be the moderator for this session. So, cervical cancer is prevention is possible. That's the whole idea where the nation is going towards and promoting the HPV vaccine. So one is prevention. The next is early diagnosis. The treatment is definitely possible. So we are going to have two parts of this session about HPV vaccine. One is debunking the myths about HPV vaccine. And we have Dr. Shabana Sultana, Professor and HOD of Department of Obstetrics and Gynecology, GMC Bhopal. Madam has presented many papers in the national conferences and many papers in the international journals. She's a member of the esteemed team of Bhopal OBGYN Society, and she has held many posts in the OBGYN Society of Bhopal as past treasurer, past secretary, and as present vice president. She is an executive member of MBSR. She has done various international projects along with the Harvard University, and she has a special interest in gynec-oncology and high-risk pregnancy, and she's a master trainer for cervical screening program. So what best you can have than her to talk about
Thank you, madam.
It's about HPV vaccine. Thank you. Over to you, ma'am.
So very good afternoon, and at the outset, I'm very much thankful to Tamil Nadu state branch to give me this opportunity, and we are here to discuss cervical cancer elimination through HPV vaccination in India. It is under FOGSI Presidential Project 2025. That is Do TK Zindagi Ke. That's really important. And I request Mrs. Megha to please announce for the pre-survey, because in this training we are having a QR code for the pre-survey, so the questions can be solved by the participants.
Yeah, thank you, Shabana ma'am. What you see on the screen is a training pre-survey, which is mandatory part of the training now. You can see the QR code. Please hold your mobile camera in front of the QR code. A survey link appears. Click on the link and complete filling the pre-survey form. Once you complete, please write done in the chat so that we know your responses are recorded with us. At the end, a similar kind of code will be shown to you on the screen of post-survey. Both pre-survey and post-survey are mandatory, so that after the training, within 1 week, you'll be able to receive your certificates while also attending throughout the training program. I have also posted a link in the chat, which is pre-survey link. If you are unable to scan the QR code, you can straight away click on that link, open the form, complete filling it, and submit it. We give you 5 to 10 minutes to complete filling the pre-survey form. Once you are done, then we will move ahead. If you have any difficulty, please let us know.
So, Megha, I should continue?
Ma'am, we'll just wait for people to scan the QR code.
Yeah.
So while you're filling the pre-survey, I will just give a 2-minute quick background of this project. This is FOGSI IMA HPV vaccination project, phase 2. In phase 1, FOGSI has already trained 10,800 gynacs. In the second phase, with the collaboration of IMA, we are intending to train 50,000 IMA members across all specialties. This project is funded by American Cancer Society, and the India implementation partner is Cancer Foundation of India. The project is under the FOGSI Presidential Ambitious Initiative Do TK Zindagi Ke of Dr. Sunita Tandurwadkar Madam, President FOGSI, and is under the able leadership of Dr. Dilip Bhanushali Sir, President IMA. Dr. Priya Ganesh Kumar Madam is a national convener from FOGSI side, and Dr. Nomita Gupta Madam is a national convener from IMA side for this project. We are very grateful to all the office bearers of FOGSI and IMA together for supporting this initiative and hence contributing to cervical cancer elimination through HPV vaccination in India. We are very grateful to the AMS Tamil Nadu team, especially Dr. Jayaraman Sir, Dr. Sengu Vettan Sir, and all the office bearers who have taken a lot of effort in putting this webinar together, putting people together, bringing us all together for this wonderful program. Very grateful to you for giving us this opportunity, sir. We hope everybody is able to scan the QR code, or you are able to click on the link and complete filling the pre-survey form. Shabana ma'am, you can move ahead.
Yeah. So today we are going to discuss cervical cancer, its burden and impact in the whole world as well as in India, and human papilloma virus infection, which is the basis of creating precancerous lesion, cervical cancer prevention through HPV vaccination, which is our motto of today, and communication, making a recommendation and answering parents' question about HPV vaccine. So we are able to see this global burden cervical cancer map, and it is from the Globocon 2022. And we see that when we see the age is in this trade, mortality rate of cervical cancer on the female of all age group, these dark shades show that how much mortality is there, and where we are standing and what we have to do further to prevent all these mortalities. When we see India's burden of cervical cancer annually, we see that almost 79,000 deaths occurring due to cervical cancer, and about 127,000 new cases we are diagnosing annually. And if we don't act, new cases will increase 254% from 2022 to 2040. So we have to promptly act on that, and our action of today can change this picture of tomorrow for India. 9 women die every hour in India from cervical cancer, amounting almost 80,000 deaths each year. WHO stands very clearly that cervical cancer strikes women in prime of life, and these women, they are raising children, caring for their families, and contributing to social and economic fabric of their community. If we don't act, deaths from cervical cancer will rise globally. So we have to do a proper planning and action to preventing these deaths. But this unfortunately does not have to be this way what we want. This is by WHO Director General. For the first time in history, we can eliminate cancer. And this is a WHO call. We have to carefully see this slide, achieving elimination, a global strategy for elimination of cervical cancer, in which 90% of the girls fully vaccinated with HPV vaccine by the age of 15, 70% of women screen using a high performance test by the age of 35, and again by the age of 45, and 90% of the women with a precancerous lesion treated, and 90% of the women with invasive cancer managed. So this primary vaccination from the HPV vaccine is really plays a very important role for prevention, and then obviously the secondary prevention by screening and precancerous lesion management. So, cervical cancer prevention strategies to reach elimination, in which we have to focus on HPV vaccination in girls. That is 9 to 14 year is a very much appropriate year for HPV vaccination. It is a recommended years in vaccination program to vaccinate 9 to 14-year-old girls. Screening in women 35-year-old and till 45-year-old, and the cervical screening should be 2 times in lifetime using a high performance screening test. Doctors are critical to meeting elimination target, not only the gynecologist, but I think it's a responsibility of each and every faculty, each and every branch doctor, like IMA members also, like pediatrician, to participate in this elimination targets. Now, there's a question of a fast check that how many women die each year in India from cervical cancer. I've already mentioned previously, and I think we are not having time to wait for the participant to answer. But I think everybody knows that the answer is 79,000. The answer is 79,000. These women die each year in India from cervical cancer. What causes cervical cancer? Human papilloma virus. What is this human papilloma virus? We have almost more than 200 types of human papilloma virus. At least 14 type of HPV can cause 6 type of cancer in men and women. Cancer of the cervix, vulva, vagina, penis, anus, and oropharynx as well. HPV infection is very common. It infects both men and women alike. An estimated more than 50 to 80% will get at least one type of HPV infection in their lifetime. So more or less, we get this HPV vaccination very commonly in our lifetime, but most of these HPV infections do not have symptoms. The body fights off most of the HPV infection in about 2 years, but not all. If agar HPV does not go away on its own, it can cause changes in the healthy cell and ultimately precancerous lesion. So how does this HPV infection spread it? We have studied that it is very common, almost more than 50 to 80% population, they have HPV infection, but this infection goes off. But how it is spread? Spread through the single exposure, skin to skin contact, primarily during sexual intercourse contact. HPV vaccination is the most effective method of primary prevention. Now, how does this HPV infection progress to cervical cancer? See these slides. Normal cervical cells are there, and then there is a second slide showing HPV infection. And another slides are showing that this HPV infection persists, then it causes precancerous cells. And these precancerous cells actually visualized on the cervix as cervical intraepithelial neoplasias. But a very important catch point is here. That is, this HPV vaccine took almost 15 to 20 years to develop cancer. So there's a good amount of time we have to catch this precancerous lesion. So screening plays a very important role when once the woman is infected by the HPV infection, we can catch this precancerous cell by doing various screening tests of high quality, as well as some tests which are available in the low resource setting as well. And then almost 20 years it took to develop the full blown carcinoma. So we have enough time to diagnose precancerous lesion and prevent patient to develop a full blown cervical cancer. Which HPV infection become cancerous? There are various strains like high-risk type of HPV typing, and these type they cause cancer. Another thing is a persistent of these high-risk HPV infection. Now, most of the cervical cancer they are caused by HPV. Yes, 84% of the cervical cancer in India we have diagnosed they are caused by type 16 and 18, and the persistent HPV infection causes cervical cancer. So HPV vaccination is the best way to prevent HPV infection and cervical cancer. Again, there's a fast check. Persistent HPV infection can causes what type of cancer? Options are cervical, oropharynx, cervix, vulva, vagina, cervix, anus, and penis. And D option is all of the above. I can ask any delegate to answer this by unmuting themselves that what is the answer. Megha?
Answer is all of the above. Answer is all
Yeah,
of the
ma'am.
above, ma'am.
Yes. Yes, because there are so many strains, they are causing cervical, vaginal, vulval, as well as anal and penile cancer. So the answer is all of the above. Now, preventing HPV infection, HPV vaccine facts are really important. HPV prophylactic vaccine, there are recombinant L1 capsid protein, that is a virus-like particles are there in the vaccine. Non-infectious, non-oncogenic type of particles produces higher level of neutralizing antibody than the natural infection. Now these vaccine, there are lots of many type of vaccine are available in India and in globally also, and they have different type of strain of HPV and the genotype of HPV in that. One is a bivalent vaccine that is containing 1618, and now we are having good quadrivalent vaccine. And in India, it is available by one Indian company also, quadrivalent vaccine, which contain 611 and 1618 type of genotypes, and nanovalent vaccine, which contains 611, 1619, 31, 33, 45, 52, 58. All these type of high-risk strains are there in a nanovalent vaccine. These 6 and 11, 90% of genital warts are controlled by this. 1618, almost 84% of cervical cancer is caused by HPV 1618. So if this genotype is there in the vaccine, its prevention is really very good. and about 31, 33, 45, 52, 58, these type of genotype, 15% of cervical cancer, they are caused by these type of strains. So we have all type of variety, and I think quadrivalent suffice quite well because nanovalent is very costly. Now, there are certain fact that it is effective, it is safe. HPV vaccine, it is effective, it is safe, it is licensed to start at the age of 9, and our recommendation as a doctor is really matter. So the facts of HPV vaccination is really effective. And Megha, do you want me to continue or Dr. Shabista will take after that?
Shabista ma'am will continue, ma'am.
Yeah. So I request Dr. Shabista to continue after these slides. Dr. Shabista, are you there? Megha, can you check?
Ma'am, actually, I was supposed to do from slide 36.
Okay. It's
This is slide 28.
okay, sorry. You just interrupt me in between. I'm not
Yeah,
able
yes,
to
ma'am.
see the
Yes,
number
ma'am.
of slides. So
Okay,
HPV
okay.
vaccine is effective, and various studies have been done. In Sweden, 2022, 1.7 million females over 10 to 30 years of age between 2006 to 17, they were followed and evaluated until their 31st birthday. And they saw that there are various key findings in which they find that 88% protection is there against the invasive cervical cancer when the girls are vaccinated before the age of 17 years. So it's a good study to be quoted. Again, there is an IR trial that HPV vaccination is quite effective, and this study is published in 2024 in which they assess the women who are unvaccinated and the women who are vaccinated with 1, 2, or 3 doses, and they saw that the efficacy is really good even with a 1 dose, that is 92%, with 2 doses 94%, and with 3 doses it is 95.3%. So this study also recommend, and that one of the very good study showing that HPV vaccination is very effective for the prevention of cervical cancer. IR trial 10-year post-vaccination study, and they are also recommending that any type of dose is really effective. Little bit efficacy may changes, but effectiveness is really matters in a vaccinated girls. Now, fact is this HPV vaccine is really safe, and the HPV vaccine are safe, excellent safety profile. WHO Global Advisory Committee on Vaccine Safety, this statement continued on the safety of HPV vaccination 2017, and since the license of HPV vaccine is there, they have found no adverse effect concern based on many large high quality studies, and the new data presented at this meeting have strengthened this position that this vaccine is really safe without any side effects. When we see the long-term safety data, we see that there is no increased risk of anaphylaxis, stroke, any type of seizures, no autoimmune disorder, no type of any central nervous system immune effect, no venous thromboembolism, no multiple sclerosis. So all these data is showing that HPV vaccination is quite safe, because many parents have myth in their mind that this vaccine is not very safe. Why I should give it to my girl? But yes, the data is showing that this vaccine is quite safe. Like any other vaccine which we are recommending in the immunization schedule, this vaccine can also have a good safety data for recommending of the girls of 9 to 14 years even after the years. HPV vaccine can protect, not harm the fertility. HPV vaccine can help and protect the women from future fertility problem linked to cervical cancer in precancerous lesion. HPV vaccine is not hindering any type of fertility and no harm in fertility. It is a safe way to protect health and ability to have healthy babies. Are HPV vaccination safe? Yes. HPV vaccine are safe just like any other vaccine. Millions of children have safely received HPV vaccine in over 100 countries, and these vaccines are the most studied vaccination available, and studied show that they are very safe. Now, fact is HPV vaccination start at the age of 9. Yes,
Ma'am,
vaccination. Yeah.
yeah. Can I take
Shagufa,
over?
you
Yeah.
continue.
Thank you so much, ma'am.
Thank you.
So HPV vaccination, the benefits of vaccinating at early ages, that is 9 to 14 years. So the HPV vaccination starts at an age of 9 years. The WHO recommendation starting HPV vaccination at age 9 for it is to be very more effective. Next slide, please. Why is it effective? Because the immune response is stronger here, increased likelihood of vaccinating prior to the first HPV exposure, and opportunities to combine with the other childhood or adolescent vaccines like Tdap booster in our country. So here we have a next question, which goes as HPV vaccine effectiveness dash with age. So what happens to the HPV vaccine effectiveness? It increases, decreases, or stays the same? Can anyone please unmute yourself and answer the question?
Increases.
So no, then can we have the next slide, please? So the correct answer is B. It decreases with age. So the question here was the effectiveness decreases with age. So the sooner you give, the effectiveness will be at a high amount. But as soon as you give it at the advancing age, the effectiveness of the vaccine decreases with the increasing age. So it is when you give the vaccine, the effectiveness lasts for how long? Okay. So can we have the next slide? Okay. So according to the Central Drug Standard Control Organization, we have 4 types of HPV vaccine approved by them. So we have the bivalent vaccine, which can be given to the females. This covers HPV strain 16 and 18. We have the quadrivalent vaccine. This is mainly by the Serum Institute of India, which can be given to females and males. HPV, it covers strains HPV 16, 18, 6, and 11. We have the quadrivalent by the MST given only to females. It covers 16, 18, 6, and 11 strains. And we have the nonavalent vaccine given to females as well as males. It covers all the strains of the HPV like 16, 18, 6, 11, the major ones, and 31, 33, 45, 52, and 58. So GSK bivalent was released in 2008. It is no longer available in India. The MSD quadrivalent one was again released at 2008. The nonavalent was released in 2018, and the quadrivalent by Serum Institute was released in 2022. The schedule for all the brands, like for 9 to 14 years of age, the 2 doses are to be given at 0 and 6 months. Above 14 and immunocompromised, you can give 3 doses, that is at 0, 2, and 6 months. Next slide, please. The previous slide, ma'am. So HPV vaccination guidelines according to the Ministry of Health and Family Welfare announcement and FOGSI GCPR as well as IAP, immunization schedule strongly recommends a 2-dose schedule for the primary target groups of girls with age 9 to 14. The NTAGI has recommended introduction of the HPV vaccine in the Universal Immunization Program with one-time catch-up for 9 to 14 years old girls, followed with routine introduction at age 7. With vaccination at older ages, the vaccine is also labeled for women up to 45 years. However, the vaccine is not a therapeutic vaccine and will not be treating the existing pathology. There is reduced efficacy in older women as most people first contract HPV in their teenage years and early 20s. Now, FOGSI GCPR, the Good Clinical Practical Guidelines Recommendations 2023, suggest a 3-dose regimen for older women, evaluating the evidence as level 2 grade B. Recommending it to women in adulthood may lead those women to think their daughters can wait to get vaccinated and potentially reduce the likelihood of vaccination on time for girls. Now, for the good GCPR guidelines given by FOGSI is Optimal dose schedule would be 2 doses for 9 to 14 years females at least 6 months apart, and 3 doses above 15 to 26 years, that is at 0, at 1 to 2 months or 6 months and 6 months, with 3 doses for older women till 45 years. Regular screening as per the guidelines has to be followed in this age group. Now, the reduced dose schedule is 2 doses recommended by the WHO SAGE recommendation. An alternative single dose can be given. Now, here the schedule is 1 or 2 doses for 9 to 14 years, 1 or 2 doses for 15 to 20 years, 2 doses for 21 years and above. Single dose schedule can be used for girls and boys between 9 to 20 years. For boys, boys can be vaccinated between 9 to 26 years. Between 9 to 14, they have to follow the 2-dose schedule of 0 and 6 months. 15 to 26 years, again, 3-dose schedule is to be followed for boys again, 0, 2, and 6 months each. The reduced dose of HPV vaccine awaits the DCG approval by WHO. Next slide, please. Okay, that brings us previous slide. Okay. Previous slide, there's a question, right? Okay. The HPV vaccine landscape is shifting globally. That is 145
You
or
can tell the
70.
question and answer.
Hello?
You can tell the question and discuss, madam. If it is not there, you can tell the question and discuss.
Okay, we can have the question in the next slide. It's in the next slide. Okay. So can I go ahead with the slide? Yeah,
Take
so it
all the
is.
questions at the end.
Okay, ma'am. So HPV vaccine landscape is shifting globally. That is 145 or 75% of the countries have introduced HPV vaccine in their national immunization programs. Single dose, 64 countries have implemented 1-dose HPV vaccine. HPV vaccine delivery by sex, that is males or females. So 71 countries, females only, and 76 countries, both sexes have been given vaccination. So can we have the next slide, please? So we have a question here. So what age does NTAGI recommend HPV vaccine start at? So can anyone unmute yourself and answer the question, please?
9.
Yes, that's the correct answer. So A is the correct answer here. Okay, so we'll have the next slide, please. The doctor's recommendation matters. Of all the information we have covered today, this is the most important one. So doctor's recommendations matter a lot. When you are talking to a parent about the HPV vaccine, what you say matters a lot. How you say it matters more. It is critical that when you talk with community members and parents, you are able to communicate in a clear and a simple language that is easy for them to understand. So next slide, please. Research conducted in India found that parents consider healthcare providers the most credible source for information on HPV vaccination. So the position of doctor is after God. Only doctors can cure us. They are very caring and answer for all the questions, is by a quote given by a mother in Kolkata. Again, we have another quote by a father given in Howrah. When the doctor tells me something related to my child's health, I trust him since he is attentive to my queries and doubts. It helps increase my trust in him. We go to the doctor to cure our diseases, and it is the doctor that heals us. So we have to rely on the doctor, and the opinion of the doctor must be the given importance. Next slide, please. So the parents trust in doctors. Previous slide, please. Okay, next one. So as doctors place a high degree of trust in a recommendation, it is our responsibility to recommend the HPV vaccine to help parents protect their daughters from cervical cancer. NTAGI has recommended introduction of HPV vaccine in the Universal Immunization Program with a one-time catch-up for 9 to 14 years old girls, followed with a routine introduction at age 9. You can follow a simple roadmap when recommending previous slide, ma'am, please. You can follow a simple roadmap for recommending the HPV vaccine. Recommend the vaccine. Second, if a parent has any questions, listen to them and respond to the questions with brief fact-based messages. Next slide, please. Once you have established that the patient is between 9 to 14 years and has not received the HPV vaccine or completed the series, make a clear recommendation. Note the child's age. Let them know that all the girls at this age are due for a vaccine that prevents cervical cancer. Recommend that they should take the vaccine. An example would be that Preeti is 9 years old, which means she needs her first dose of HPV vaccine, which protects her from cervical cancer and other HPV cancers. Cervical cancer is very common in India, and I recommend getting the HPV vaccine. Next slide, please. So always focus on the HPV vaccination as cancer prevention. For example, if a patient brings up something about sex or marriage comes up, redirect the discussion to cancer prevention. Like a parent can ask, my child doesn't need this vaccine because she is not married. You again have to say, I understand many vaccines are given at younger ages to protect them from future diseases. The HPV vaccine prevents cervical cancer in her future and works best when given at 9 to 14 years. Next slide, please. Most parents will not come in asking for an HPV vaccine. So you will have to find or make opportunities proactively. Recommend the vaccine to parents between 9 to 14 years of age. So opportunistic times when they come for other vaccines like Tdap, TD, booster doses, you can always recommend an HPV vaccine again for them. Next slide, please. If a parent has a question, listen to their concerns. Address the parent's concern using a fact-based message. Follow up by clearly recommending them to get the HPV vaccine. Next slide, please. Clinical scenario. A parent has brought their 10-year-old daughter to your clinic for a non-serious sports injury. Use this opportunity to make an HPV recommendation. Next slide, please. Just one sec. Yeah. Next slide, please.
Next slide. Yeah.
So parents, does HPV vaccination work? So these can be the questions of the parents in our scenario. So we would be answering them as, yes, HPV vaccination works very well. And studies have proven that HPV vaccination is effective at preventing cervical and other HPV cancers. HPV vaccination can prevent most of the cervical cancers. Next slide, please. So does HPV vaccine cause side effects? Now, HPV vaccine is a safe vaccine with no long-term side effects. As with any other injection, your child may have mild side effects like fever, redness at the site of the injection. Very rarely, a child can have an allergic reaction to any injection. As with all the injections, we will keep your child seated for 10 to 15 minutes to prevent the possibility of fainting. Next slide, please. Will HPV vaccination harm my daughter's fertility? No, HPV vaccination does not cause fertility problems. Rather, HPV vaccination prevents most cervical precancers and cancer and can protect fertility. The HPV vaccine is a safe way to help protect health and an ability to have healthy babies. Next slide, please. So can she not get the vaccine after marriage? The HPV vaccine is recommended for all the girls aged between 9 to 14 years and is not based on the marital status. All girls should get this vaccine before their 15th birthday. Next slide, please. Is there a cost to the vaccine? Yes. Today, the cost is whatever the cost, depending on the vaccine, can be stated. And then the delivery can be given. For the delivery charges, there can be a cost. So if the cost is too expensive for the parents, you can always let them know that the government is considering adding the HPV vaccination for girls between age to 9 to 14 in the universal immunization program soon. Next slide, please. Can boys get the HPV vaccine? Yes. The HPV vaccine can be given to both boys and girls to prevent HPV cancers as they grow older. Next slide. So here we again have a question. Parents respond best if you frame the HPV vaccination as an optional vaccine, a cancer vaccine, or an STD prevention method. Can anyone please answer the question?
B, madam. B, cancer prevention.
B.
Yes, this is the answer. So the answer is cancer prevention vaccine. Next slide, please. So now this is an open session now. You may ask questions and we will be answering the questions given by you.
Ma'am, few more slides ahead, and while taking the post survey, we'll take all the questions. Yeah.
Okay, ma'am. So we'll go ahead. So doctors are critical to cervical cancer elimination. Doctors are the most trusted source of HPV vaccination information for parents. Increasing HPV vaccine coverage in girls will avert more deaths per person vaccinated than any other immunization activity. Over 80% of cervical cancers can be prevented through HPV vaccination. We can eliminate cervical cancer in India. Next, we are at a historic moment where India is poised to vaccinate girls across the country, which could ultimately lead to 90% vaccination rates, which is needed to eliminate cervical cancer in India. As a physician, it is our job to champion this like a life-saving vaccine across India. As you will hear today, as the most trusted sound of health information for parents, what we say, how we say it matters. Parents are depending on us to provide clear recommendations and answer their questions with facts. So let us look back on this moment in time in 20 to 30 years with great pride that we did not let this opportunity go by. Next slide, please. So a quick run on our takeaways today. HPV is a very common infection. HPV can cause 6 types of cancers. HPV vaccine is safe. HPV vaccine is effective. Your recommendation matters a lot, and not enough children are being protected. Next slide, please. So before we close today's session, let me tell you that this training is just the beginning and you are not now a part of India's cervical cancer elimination plan. Make sure you keep yourself updated on HPV vaccination through the monthly newsletter from CFI. Keep your community aware and you can ask for any customized PPT. Our website of Preventing Global HPV Cancers has resources for you to use. They are in multiple Indian languages too. So make sure to encourage other IMA members of your branch or other branches to join this initiative of IMA. And at the end, remember to share your work with us. We will email you once every month and showcase your work. Next slide, please. This is the resource slide that I was talking about. Many resources have been created in collaboration with the physicians across India and are available to support you in recommending the HPV vaccine. So just the facts for the HPV vaccination, counseling the parents, clinic posters and parents handouts and more. So you can access the QR code for the resource materials. Next slide, please. As our session comes to an end, you are requested to take this post-training survey. Thank you for taking this session. If you have attended the total duration of the training, you will be issued a certificate of attendance. In 7 days, the certificate will be sent to the IMA for circulation. This training is not the end, it's the beginning. So talk HPV loud and clear. Thank you to all the partners for Prevention of Cancer Foundation of India, FOGSI, IMA, IARC, WHO, American Cancer Society's Global HPV Cancer Free Program, and Cancer Research UK. Thank you everyone for giving me this opportunity. Thank you to all the dignitaries present here for the meeting.
Thank you, Shabista ma'am.
you,
Thank you
madam.
so much.
Thank you, Dr. Shabista, a person who has done a fellowship in preventive oncology. It was very extensive and very clear. Can we have the questions now, or 2-3 questions?
Madam, at the end of the session only,
Okay.
we will go to the
Okay,
questions,
sir.
madam.
Okay, thank you, sir.
Kindly give your input, madam. Both the moderators give your final
We
input.
request
and then
all the
next.
participants to kindly ensure you're filling the post survey so that we can close the post survey after 5 minutes and declare the session as ending the session. If you still have any questions, some of the questions I have already answered in the chat box, but if there are any more questions, kindly come forward.
Madam, Dr. Sundaramurthy, pulmonologist from Chennai.
Yes, sir.
Hello.
Yes, sir. Yes, sir.
Should we include vaccination, HPV vaccination in the students' health checkup going abroad?
Yes. If Dr. Sultana ma'am, would you like to answer or should go ahead? Okay, we any opportunity of giving a vaccine to anyone, girls between 9 to 26 years or boys between 9 to 26 years, you should grab that opportunity to give the HPV vaccination, as this is the only vaccine which can prevent cancer. Okay, so I think any opportunity should always be taken, whether the patient was screened before, for screening as well and for vaccination as well. So it should be included in the health program. Yeah.
Can I answer that question? Hello?
Yes, sir. Please go ahead.
Actually, the countries which require the medical certificate, they specify what all vaccination has to be done. So those vaccination has to be covered. Regarding HPV vaccination, whatever the Drug Control of India has recommended, those things has to be only implemented and it has to be only preached. We should not even talk outside the Drug Control of India's approved indications and approved age group, approved sex. So I think we should restrain ourselves because I was part of the pilot project of vaccinating Kakinada. On trial basis, we had vaccinated Kakinada girls between 9 to 14 years, and there were some media over enthusiasm to criticize a few deaths which happened, and in the parliament also, the parliament our ethics committee chairperson had to be called for that parliament body, and they had to explain why the deaths happened, and although the autopsy reports showed that had nothing to do with the vaccination, but still we should, since nobody would protect us if there is any mishap or any casualties, so we should only preach and practice whatever is recommended by Drug Control of India pertaining to HPV vaccination.
Should we do
Yes,
any
absolutely.
biomarker test for the efficacy of the?
No. There's no need for biomarker test. Only we have to, because biomarker test itself is more expensive than the vaccination. So
Exactly.
biomarker
Right.
testing is not recommended for vaccinating. Only just follow the. See, the reactions are mainly because of the preservatives and other things, not as say to the vaccine as such. So that can occur to anybody for any vaccine as such. So we should always take concern in that pilot project. The consent was given by warden, not the parents. So that was a big issue they made out of vaccinating hostelers who were in the Kakinada tribal belt. So we had a lot of troubles. That's why till now, even though the President of India has inaugurated it and made a symbolic launch in the launch and Parliament has passed. I mean, passed and budgeting was done. Still, there are some cases going on in certain courts. So that's why Government of India is still hesitating to start in universal immunization program. So we have to keep on reminding to government and we have to vouch that we would be practicing whatever Drug Control of India has approved and keep demanding. That's the way to go about.
Yeah.
I was requested to give write up to Prime Minister for including Telangana as a pilot state to vaccinate HPV in universal vaccination program, and it was conveyed to Prime Minister. Then only all this budgeting and in the pre-budget session, all those things were done. But since there are certain cases still going on in some courts and other things, Government of India is hesitant. But still, we as a IMA body, we have to keep on reminding and requesting government to make it implemented in universal vaccination program as soon as possible.
Yeah.
I have one question.
Yeah. Please have other participants. Yeah, please come up with the questions.
Yes, ma'am. I am Dr. Paramasivam from Tamil Nadu, Dharmapuri district.
Yeah.
You mentioned up to 45 years of old, we can give the vaccination. Could you explain us how much the efficacy will be if the age progress? If we can confirm the patient, like if you are vaccinated, then you will be almost 75% free from the getting cancer. Is there any possibilities like that? We can assure them if you are vaccinated after the age of 40, you could that probability of getting cancer will be reduced to half or 78%. It's like that. Is there any study made?
Shabista ma'am?
Can I answer that question, madam?
Yeah, sure, sir. Sure, go ahead.
The efficacy after 14 years is very low, and we have to. That's why we recommend three doses of vaccination, and we should not try. At least from Drug Control of India, we have not received approvals for beyond 9 to 14 years, so we should not keep that as a standard recommendation. Only in a special cases when the patient or the subject himself, themselves are very, let's say, for example, in commercial sex workers or some groups only, probably on an experimental basis, we can use it, but not on a routine basis, since the efficacy is low and complication rates are more.
Yeah.
Sir,
I want to add here. Hello, sir. I want to add here that the sir is right. This age is quite an extreme for the efficacy to calculate for vaccination. Here in this age group, we have to focus more on the proper screening from 35 to 45. But if proper screening can prevent her from cancer rather than giving vaccine, because the efficacy is quite less in this age group.
Plus, I would like to add a point. HPV vaccination just prevents the recent infection, as in if she as in if she's already infected with HPV and she already has a precancerous lesion, it is not a therapeutic vaccine to deal with the present infection. It is going to prevent the future infections which she might have in future. So, vaccination at this age, a very small percentage effectivity is there. But if she takes at between 9 to 14 years of age, the effectivity is the maximum. So our primary target is to vaccinate everyone possible between 9 to 14 years, which will help us reach our targets, closer to our target.
Actually, it is recommended that before 15th birthday, the child should complete 2 doses of vaccine between 9 to 15. From 15 to 26, 3 doses, and 26 to 45 for women with screening 3 doses. For boys, recommended till 26 years only. With immunocompromised children, even if they fall into the age group of 9 to 14, that is before 15, give them 3 doses.
Yeah, ma'am. One small request that.
Yes, sir.
That in Tamil Nadu, already in the vaccination schedule they have included, and for the school children they have started doing the HPV inoculation, madam. So the only request is that let we make in the universal immunization schedule at least by the end of this year. We have to request from the government to include the HPV vaccination in this universal immunization schedule this year. That should be the main aim of the IMA, because they have taken this as a very big project. So that is the only one thing. The another thing is that we are having this PowerPoint presentation, no, madam. This PowerPoint presentation can be sent it in a WhatsApp to all the people, and for all the IMA members from the headquarters itself, they can send this message through their Google through their network. From their website, they can send it to each and every person, so that it will reach everyone. And another question you have asked in the post evaluation session, how to include more people in this program. The only thing is we can request our medical councils and the NMC to include this HPV session like this to be an essentiality for all the people to complete it, to get the renewal of their registration. That is the thing we need to request through the NMC also, and also to the government. These are all my suggestions, sir. Thank you.
Thank you. Thank you, Rajesh Babu, sir. Thank you so much for making this wonderful suggestion. IIT, FOGSI, IMA have been after the government to bring this into the national immunization schedule. The work is already on. We are also waiting for that notification to come, so that every child in India gets vaccinated falling into the age group of 9 to 14.
Madam, to popularize this vaccination, humble suggestion, madam.
Yes, sir.
One is involvement of alternative medicine practitioners, and any impact on religion and HPV vaccination. This is another sensitive area in the country like India.
Sir, you also, we have all witnessed at the time of COVID, what would have been, it is an impact when you launch any public health program in India. We are diverse groups in India. So some of the ethnic groups will definitely react as usual. They react to any other vaccinations. So definitely this will also face that kind of reaction when it comes in the UIP. But through these, but I would like to request all the members attending the session now with us is we are doing these trainings not to just give a certificate, but we are requesting all the members attending kindly start recommending from your own house. Through the first phase, we realized even the medical fraternity are not vaccinated. Their own children are not vaccinated. So it should start from our home, our niece, our relatives. Every patient that is coming to your clinic or hospital has somebody falling into the age group of 9 to 14. We are requesting, we will be sending you 2 links to the central, to the AMS TNSB. One link is a customized PPT, specially designed to deliver awareness programs in nearby schools, colleges, NGOs. Kindly connect to them. There are Seva Mandals, there are religious programs happening. Every opportunity, please take that opportunity. Then their second link is link of resources. There are few handouts in 6 different languages. Wherever you are going, you carry these handouts, distribute it, even at your own clinic or hospital, respective clinic or hospital. You can keep these handouts. Ask your staff to hand over. There are posters you can put up in your display areas wherever you are going for a program. Carry these posters, put up these posters in the schools and in the colleges, and just see by word of mouth, people will come to you to ask questions. Give them satisfactory answers. Maybe not in the first or the second sitting. They may go to some other doctor for reference, but finally they are landing up to you. They will come to you, ask questions, and kindly recommend them. See into it that the child gets at least the first dose now, if they are falling into that particular age group. If you are associated with medical colleges, wonderful. You have all the students in hand. Let the students get vaccinated. So we have to find opportunities.
Madam, what is your phone number?
I have already posted in the chat, sir. Megha.
Sir, madam has answered so many questions in the chat box itself, sir.
Yeah.
Thank you, madam.
I'm posting it again.
One more. Yes, madam. Is there one more question? Can the individuals with prior genital warts or abnormal pap smear be vaccinated?
Yes,
Madam?
patients with abnormal pap smear also can be vaccinated for the future infections. Plus, they can be treated for whatever abnormality they have. For future
Is there any
infections,
protection?
yes, she can be vaccinated if she is under 45 years of age. She can be vaccinated according to the schedule, and she should also be treated for whatever abnormality she has from the previous infection.
And Megha, there is no role for booster dose, right?
No booster dose, ma'am.
Yeah. No, there are many questions with respect to booster dose.
No booster doses. Kindly complete the schedule. No need for booster doses.
I'm Dr. Annapurni. I would like to ask a question.
Yeah, ma'am. Please
Yes,
go
madam.
ahead.
Be muted. What are the common side effects that's expected with this vaccine?
Yeah, Shabista, ma'am.
Only few side effects, like any other vaccine, can causes slight fever, malaise, all these things. Nothing significant. Dr.
Yeah, mild
Shivani.
fever and request to give it in a setup, in a medical setup.
Okay. Okay.
Regarding the consent, also, I want to add that I'm working in a medical college, and all my postgraduates also vaccinated by this, and other girls are also coming like nursing college and all. So we have made a proper consent form before this vaccine. We have made it. Just sir was asking about the consent. The proper consent should be taken from the parents before vaccination. Few side effects, only minimal, like fever. I have not noticed anything. Only one girl came with a slight fever and malaise, and another girl come with a vomiting. That's it. Nothing significant. Nothing.
As it was discussed, many doctors do not vaccinate even their own family children. So there's a common misconception among doctors themselves because it can cause
We are here actually to to break
many are
this.
not. That is the reason why I'm asking you these questions.
Madam, we
Madam,
are
any
conducting
contraindication?
trainings. Yeah, we are conducting trainings on an everyday
Contraindications
basis.
or
Yeah,
precautions.
and we
Pregnancy,
are
sir.
Yeah.
Yes, madam.
Pregnancy is an absolute contraindication.
It is not given in pregnancy.
Lactating woman?
They can give, sir.
Pregnancy,
Lactating,
yes,
we are
you.
not practicing still.
Pregnancy, you should not give HPV vaccination. For lactation, it can be given, but we do not have studies again on the lactating females. Now, I would like to clear everyone's thought by stating there are 109 studies which have been done among 2.5 million people in 6 countries. And there were no serious side effects which were observed apart from the normal side effects like redness, allergic reactions, fainting. Again, HPV vaccination should always be given in a hospital setup because a patient's tolerability to the vaccine cannot be stated. If she has any allergic reactions, again, she should be always treated for the same. If a patient having allergic reaction, if a girl who has an allergic reaction to all the vaccines priorly, which she was given in a universal immunization schedule. So if she has any anaphylaxis history or something, then the patient should not be given HPV vaccination and it should be a contraindication in such patients. Or you have to take a proper consent for such a patient and then you have to keep everything ready. If she goes for anaphylaxis, you should have all the crash cart and everything ready. And then if she is very strongly willing for the vaccine, you have to give the vaccine and then see for the, obviously keep the patient under observation and see for the side effects.
One small suggestion, sir, as IMA people, we are talking more of HPV vaccine for female cervical cancer, but definitely, as we have already discussed, it has a role in boys also because it has a protection against penile cancer, anal and oral cancer. So that has to be taken into account. It is for both the sex.
Yeah. We are recommending for boys also, ma'am. Through these trainings, we are stressing on recommending for boys also till 26 years of age.
No, I want people to know about that also. We are only talking about cervical cancer.
So
Yeah,
HPV
yeah.
vaccine also, as in prevents boys from having penile cancer, oropharyngeal cancer, any genital warts, but it also helps in creating a herd immunity for the females as well. So a boy taking a vaccine is actually preventing her sister, mother, and other females in the family from having a cancer by actually creating a herd immunity. So that is also a role for boys if they take HPV vaccine.
Madam, as a take-home message, one small request, madam, which is the best vaccine that we have to suggest them? Because the quadrivalent, the 9-valent vaccine, all these things are there. Which is the vaccine that we need to suggest, if at all needed? Beyond about the cost, we should not think about the cost. You suggest which is the vaccine we need to suggest them, if at all they are
So
going
the
to take.
best vaccine would be a nonavalent vaccine, which has all the strains. So it protects the person from everything, the warts as well, from the low risk HPV infection, the cervical cancer, and 611, those things. The nonavalent. Sorry, the price of nonavalent is around 10,850. But obviously, if the patient is not affording, then you can go ahead with quadrivalent, which is very generally and very commonly given in India. So the quadrivalent covers around 84% cancer-causing strains like 6, 11, 16, and 18. So quadrivalent, the price is around 4,000 to 4,500, depending on the MRP. Actually, the MRP is 4,000, but with the MR and all, you can get the discount. So, quadrivalent provided by MSD can also be given, which is one of the most common given in India.
So for your
For the-
question, if
Cost
you
is
want,
also less. Quadrivalent by the Indian company, the cost is quite less.
Yeah, it is
quadri-
2,000.
Right now,
Cervavac.
almost 1,700.
Cervavac from Serum Institute, it
Yeah.
costs 2,000.
The
It
cost is
also
around
quadrivalent
2,000. Yeah.
vaccine.
Sometimes it gives to
Equally
doctors.
Trade names
effective.
of these vaccines.
Pardon?
Trade names of these vaccines.
Cervavac by Serum Institute. Quadrivalent
Quadrivalent by MSD.
Gardasil 4 is MSD vaccine, and nonavalent is again MSD vaccine.
Yes.
Madam,
So
how
for-
long the immunity lasts for after vaccination? What's
Yes,
the
sir.
duration
It's
of
the
immunity?
Gardasil 9, Mega. It's Gardasil 9. No, novalent.
Madam, how long does the immunity last after vaccination?
Sir, can you be little louder, sir?
how long does the
How
immunity
long
last?
Yes, madam.
The immunity is lifelong because there has been no recommendation to give a booster dose. So immunity is supposed to be a lifelong according to the studies carried out. But again, screening is a very important part. Screening with the high specific tests is a very important part. So up till 45 years, yes, you can give vaccine. But the immunity is lifelong, that as per the recommendation, but screening is a very important part,
So
which starts after 21 years of age.
The vaccine, they have identified only 9 strains against which the vaccine is produced. So there is a spectrum of HPV strains. Though, so doesn't mean that we cannot have cancer with the other strains. So that's why madam is saying that we have to continue screening even after vaccination. So that is a take-home message with which we have to know, sir.
Chairman, sir.
Yes, sir. Are there any questions?
Madam, you have answered most of the questions in chat box itself.
Yeah.
So thank you very much.
Yeah.
I think pooling
Wonderful,
of
wonderful
so many
discussion.
questions. Yes, madam. Yes, madam.
Yeah.
Chairman,
Wonderful
sir.
discussion of after the training. And we are very grateful to Dr. Shabana Sultan madam and Dr. Shabista Patel madam, the conveners of the program, Sujata madam, Senthil sir, Jayaraman sir. Jayaraman sir is here, Dr. Rajesh Babu sir, the President, Dr. Sengutivan sir, for all for giving us this opportunity and be with you all for this wonderful discussion we had. So training was just an integral part, a formal part of the process, but we wanted to have this one-to-one discussion. And we would request, I have posted my number in the chat. One thing is an announcement that the certificates will be given to you via mail also, and a link will be sent to TNSB office so that you all receive your certificates in time. And also I have posted my number. If if you wish to conduct such sessions in your local branches, virtually, we are always available. You can always connect to me. Thank you once again.
Thank you, Mega ma'am, for a wonderful session. We had a wonderful
Thank
our session on HPV workshop. Thank you, Sabana ma'am. Thank you, Sabisha ma'am. Thank you very much. God bless you. We'll do all good work, madam. Thank you very much.
Thank you, sir. Thank you. Very grateful.
Has to be taken for. Shall we go to the next session?
Yeah, please go to the next session, ma.
Yes, sir. Are you seeing the slides? Slides, sir.
Three, ma.
Yes, sir. The next, yes, sir. Yes, sir. The next topic is the mental health awareness talk by our Dr. Sweta Raghavan madam. She is a senior consultant psychiatrist in Asthma Mind Care Hospital, Kodambakam, Chennai. We welcome Dr. Sweta Raghavan madam. Over to Dr. Sweta. Madam, please kindly share your screen.
Sendil sir, introduce the moderator. Dr. Maithili ma'am. Maithili ma'am is here. You ask the Maithili ma'am. Maithili ma'am is a senior consultant.
Yeah, sir. Good evening.
Assistant professor from Kilpak Medical College. Madam is a consultant psychiatrist, Rotarian, and is very passionate about all the mental health and all awareness. Madam is doing a lot of camp and other thing and all in the peripheral areas. So Madam is doing human service in the field of mental health. Over to Maithili ma'am.
Thank you, sir. Thank you so much. First of all, good evening to all the delegates of the Indian Medical Association, sir. And I would like to thank Professor Jayaraman, sir, for giving me this opportunity as a moderator. And today we have an eminent speaker for talk on mental health awareness, Dr. Sweta Raghavan, who is a senior consultant psychiatrist managing a full-fledged 20-bedded inpatient psychiatric hospital, Atma Mind Care, Podambakam, Chennai. And she has over 15 years of clinical experience in the field of mental health and has keen interest in promoting well-being of students and elderly alike. And she aims to bring in a judgment-free world where people are allowed to be themselves without fear of being ridiculed. And she completed her undergraduation and PhD Coimbatore and her PG degree in psychiatry at Madras Medical College. Her motto in life is, the purpose of life is a life of purpose. Over to Sweta Raghavan, sir.
Thank you, Dr. Maithili, ma'am. Thank you very much. Thank you to the IMA team, all the delegates. We have had a wonderful session in the beginning. I am not sure if I will do that much justice, but I'll try to do as much as I can. So we are looking at World Mental Health Day tomorrow, 10th October. Every year it is observed. And World Mental Health Week has been going on. So this year's theme is access to services and mental health in catastrophes and emergencies. So I'll give a brief overview of anxiety and depression throughout our lifespan. Then we can have a look at using mindfulness-based interventions to take care of our mental health, who are the primary service care providers. I think we all spend time so much with our patients, their families, and their well-being that we often forget and overlook our well-being. So our well-being is of utmost importance because what we have only we can provide. So if I have a sound mental health and a sound physical health, then I will be able to provide justice to my clients. So the first slide is anxiety and depression through the ages. The global prevalence is about 4.4% experience. That is 4% of the entire world population experience anxiety and depression at any given point in time. And onset is usually, see, the age is very low. Like 14 was what we were talking in the previous session, 9 to 14. So before 14 years, about 50% of people experience some form of anxiety or depression. And post-pandemic, this has increased in children and adolescents. In adults, the peak prevalence is between 20 to 60 years. Older adults, the reporting is very less. Especially in India, I don't think people take time to meet older people and ask if they are feeling depressed. And also you will dismiss saying, okay, you are old, now you are retired, what do you want to do? Why are you expecting good mental health and things like that? So we can see that the global trends, that about 55% increase from 90s to 2019, and higher rates are seen in higher income countries. So we will usually think that mental health is very poor in low income country groups, but what we are seeing is anxiety and depression is more in higher income country groups, because see, there is a lot of uncertainty. Even now we are seeing that from US people are being thrown out of job because of the US policies. So higher income countries, higher the stress, higher the anxiety and depression. So through the lifespan, if we take childhood, these are very tiny shoulders, but they have bigger feelings. So we cannot dismiss saying a child doing LKG or UKG cannot have stress. So for a child who's doing first standard or second standard, learning a mathematical table might be very, very difficult. So that the child says, I'm feeling stressed, I'm not able to cope up. So these are common stressors like separation anxiety. First time when the child steps into the school, there is a fear that parent will drop and go, and that is called separation anxiety. Then there is school pressure. Then children also see family conflicts, where there are conflicts between parents and grandparents. And so these children show symptoms of, say, sleep issues, temper tantrums, and many somatic complaints. The support that we usually provide for children are, you take the parents for therapy, you give parental reassurance, give ideas on proper parenting techniques, set routines for the children, and play therapy, mainly recommended. Sometimes even by 8 years of age, medications may be recommended based on the severity of the illness. Adolescence, I think this is the most difficult period that current generation is facing. That is because of the internet. So in this picture itself, we can clearly see the child is very depressed when doing academics, while the child is posting the next moment as if he or she is very happy on the internet. So there is a lot of social media pressure that the children have to handle. This leads to a lot of mood swings. There is a lot of withdrawal and a lot of risk taking in the form of, say, substance abuse. You have to be included in the peer groups. So what you will do is, whatever the peer does, say I want to be included in one group and they are, smoking, then I will also start smoking because I want to be included. I fear being isolated. In those cases, we prefer doing CBT initially. CBT is cognitive behavioral therapy, mindfulness techniques, while if not manageable, violence, aggression goes on, then medications play a role. Early adulthood, many of us, few of our team members may be in 35-year age bracket. So stressors are, see, you have to take care of your career, you are building relationship, then financial independence is there. So all this gives rise to burnout very fast. And so to compensate for the burnout, we are looking at substance. And so the support that is generally provided is therapy, social network, and time management. Middle age, where majority of us now belong to, say, 36 to 60. We are at crossroads. We have to take care of our health, we have to take care of our career, we have to take care of our family. And so this leads to chronic stress, sleep issues, and both these will eventually can lead to mood disorders and other major psychiatric illnesses if not addressed regularly. So the ideal thing would be sleep hygiene, take on to some hobbies, medications, have a group community. Say, for example, IMA itself is organizing so many events for well-being of family. There are family meets. So keep ourselves, occupied both professionally as well as spend time for yourself. So please remember, taking care of yourself is not being selfish. Sometimes being selfish is very, very important, because once you take care of yourself well, your family doesn't have to worry about your well-being. I think in the past few months, we have seen young doctors collapsing during rounds. We have seen in our WhatsApp that, we are losing many youngsters, whether it is youngster or an old person, every life has a value, and they are all important contributors to the community. This is chronically because I see what is very youngsters are, very busy building their practice. They ignore their sleep. They are sleeping 2 to 3 hours. They are taking on to substance like, say, smoking or drinking to keep themselves, energetic through the surgeries or whatever procedures they are doing. They are compromising on their sleep. And this leads to poor cardiac health and eventual, not only cardiac health, poor mental health, poor cardiac health, and all other disturbance, and eventually premature death. Older adulthood, we are seeing a lot of old age homes, and now the biggest business probably in our state of Tamil Nadu is bringing up old age homes, dementia care centers. Lot of retirement homes are there. Old age retirement comes with depression, memory lapses, and loneliness more so, because children or family moves away and they are feeling lonely, so they are put in these old age homes or retirement homes to say you go in a community and stay whether they want it or not. The children don't question. So let's see therapy for that. The better way, holistic way to approach is build up resilience. For all the major mental health issues, where anxiety, depression, loneliness, I think we have to build up our own resilience. So resilience has about 3 components: emotional resilience, how we think; balance; and recovery. Emotional resilience means that we have positive emotions. We see that time and again, each one of our specialty, we will have morbidity and mortality. So despite all those difficult times, we have to try to inculcate positive emotions. For that, we need a good social life. We interact with our colleagues saying, okay, I have this difficulty. How did you manage? So discuss more often, establish a social connection, and maintain balance the demands. See, you will have both professional demands and personal demands. We cannot just focus 70% on the profession and 30% on the family. No, doesn't help. So try to maintain a balance. Do take care of yourself. I'm a very, very selfish person. I prefer to take care of myself so that I don't pressurize my family to take care of myself, and they can take care of individual self. Because we are adults, we in the profession know that self-help is the best help. Let's have a very flexible thinking, which means like your own colleague can have a different point of view. And it is okay to have a different point of view. So accept the way juniors are thinking or they are behaving, give them suggestions, but ultimately at the end of the day, it's their choice. And maintain optimistic future. So the next few slides will be about mindfulness, because I believe mindfulness helps in building this resilience, which is the core of the strength of every individual. So currently we can be mindful, which is the left side of the picture, where we are worried about, okay, I have to go home, or the clinic has to run, or the presentation that I'm really making. So we can choose what we want. And this, I think all of us can try to remember that many people say, control your thoughts. You need to have more power. You need to have more willpower. I think the ideal would be you don't have to control your thoughts. You just don't have to be a slave to them. Stop letting the thoughts control you, because I often tell to my patients that thoughts are mere chemical reactions going on in your brain. So you don't have to be responsible for all the thoughts that come to you. What you can do to the thoughts, what you can do with the thoughts, whether you convert every thought into action is what determines the outcome. So I may have so many negative thoughts, but do I yield to those negative thoughts? Do I convert those thoughts into action? That can be my choice. So I prefer to use choice over control as a term. So about mindfulness, for easier understanding, it is 3 A's. There should be acceptance, there should be awareness, and there should be attention. So the triangle of mindfulness is, say, you attend to whatever is happening around you now. You accept that there may be certain difficulties, and we should be aware of things that happen around. So it's all same. If you have awareness, you will have awareness only when you have attention. And that attention will help you accept your limitations as well as your expectations. So the equivalent word in Sanskrit is smriti, which means remember. So remember to be connected with the present. So all the recent literature shows that Thich Nhat Hanh was the pioneer in bringing mindfulness. That is in 1970s. I think our Tamil literature people or Hindu mythology has mindfulness even thousands of years before. There are so many excerpts in so many scripts that we have had mindfulness, but Thich Nhat Hanh started it, so now he takes the credit. I'm sure mindfulness has there, mindfulness, yoga, being in the present has always been there with the Indian community. But our bad time, we are not people, who more so go into documentation and spreading. It is the Western people who choose to spread. So they take the credit. So this is, there are few techniques which Thich Nhat Hanh spread. This is one of them is MBSR. MBSR means mindfulness based stress reduction. So basically mindfulness is being connected with the present without thinking about the past. Generally psychiatry has a very easy line. People who think about the past are depressed. People who think about the future are anxious. So the ideal thing is be with the present. Whatever is the reality, whatever we have in hand, let's use it. So most of the mindfulness based techniques are done over 6 to 8 weeks. These are small sessions, either group therapy sessions or single sessions, cognitive behavioral sessions, done over 6 to 8 weeks, where we teach people on how to connect with the current time. So MBCT is mindfulness based cognitive therapy. Again, 8 consecutive sessions with 2 hours. These are all done in international group studies. What we usually do in Indian setup is we can do simple techniques like mindfulness walking, which I'll be showing. So generally, we fluctuate between 2 modes. Our brain fluctuates between 2 modes. One is doing mode, the other is being mode. Currently, most of us spend time in doing mode, whether we are accomplishing, whether we are reacting, we are driven by success, we are changing, we are answering, and so you do this, you do that, you do this. But being means I'm self-aware, I'm very insightfully thinking, I am driven by values. We see in the current generation, younger generation people coming up to us, there is a lack of values in them. They are, not afraid of anything. They are not, respecting their colleagues or even seniors. So they are constantly in this doing mode. If we see doing mode is reacting, being mode is responding. So reaction is when we instantly do, whereas being mode is responding. You take time to process the input and then respond to it. Okay, so in one day, if I were a beginner, how would I think? What are the things that we can do in a day where we can be mindful? The first thing is breathing. So I will probably go on to another slide where I will show what is box breathing, where we will learn that mindful breathing techniques can be done, which is already taught in yoga, breathing techniques. Mindful drinking, for example, if you're drinking your coffee, your morning drink, whatever your drink is, please sit in one corner of the room. Hardly it will take 5 to 10 minutes. Please relish the coffee. Please relish the warmth of it touching your hands. Think of the person who prepared it for you. It might be you yourself, it might be your parent, it might be your partner, or anyone who prepared it. Relish every sip and then start your day. So the idea is, I think our own parents or our forefathers would have told, please sit and eat. Ukkandu saapudunga, in Tamil we say, sit and eat, because saapadu illana udambula ottadu. The nutrition doesn't stay with you. The nutrition doesn't get into you. I think in English people say, I just grabbed a pack of my breakfast. So grabbing doesn't help. You sit, you can have a mindful drink, you can have a mindful eating. It might be a small apple, it might be a small sandwich, but please sit in one place, appreciate the texture of whatever you are having. It hardly takes 5 to 10 minutes. While what we are doing, we are grabbing our food, we are eating while watching something on the internet, something on our WhatsApp, and we are not doing justice to both. You are having a divided attention where the attention is split between, say, your WhatsApp video call and your food, and doing justice to none. You are not able to appreciate the smell, the taste, the quality of the food. Neither are you wholly engaged in doing the video conversation. The other portion is noticing your senses. I will be teaching a few techniques right down. The first one is called body scan meditation. This, if done, properly, will take about 30 minutes. I'm sure not many of us can afford 30 minutes to do a body scan. The modified version which I choose to do for myself is, the first thing when I get up from my bed is, I will just thank all my body parts from head to foot, saying thank you head, thank you forehead, thank you eyebrows, thank you eyes, thank you nose, thank you mouth, thank you cheek, thank you ears, and all my body parts down to the toe. Then my internal body parts, thanking all the system. Then a whole thank to the universe, because the universe provides me with all the nutrition that I need in the form of food, in the form of clean air to breathe, in the form of a clean environment where I choose to live. And then I choose to start my day. Even my brushing begins only after this. So I was introduced to this about 7 years back, and I have been doing that. What I have seen probably is, I cannot say only this has helped, but it adds value to my life. My body falls less sick, less often, because I am appreciating. This is called gratitude to the self. I am appreciating all my body parts which work for me, whether I am eating, whether I am sleeping, whether I am putting it on hunger. Sometimes we skip our food. Maybe we skipped our tea because we are in the middle of this session, and we'll drink tea after some time. So I put my body in dryness, thirst. I skip meals when I'm angry at my family. I do so many things. Despite all the insults that we give to our body is working. Each and every cell is working. Even when we are sleeping, our body parts are working. So I think it is most essential and most important that the first gratitude of the day starts with the self and all the body parts. I appreciate sincerely the prayer that was started, the IMA paper, may all, that is called loving kindness meditation. I have a slide on that, where may all be healthy, may all be happy. We are praying for other beings also. So this is starting from the self and going to the other people. Okay. So easier technique, breathe and smile, where we see that no matter how you are feeling, take a few moments to pause and reflect. Maybe we can do a 30-second trial now. Whatever you are doing now, please stop it. Please stop watching this presentation. I would request all of you to close your eyes. It's a brief 30-second event. We are closing our eyes. Just observe your mood. Observe your emotions. No emotion is good or bad. Whether you feel hatred for me doing the presentation, whether you like the presentation, whether you are angry that you have so many OPDs waiting for you, patients waiting for you outside your clinic. None of these thoughts are either good or bad. They are just thoughts. They are entering your brain and they are leaving. Breathe in. Hold. Breathe out. The breathing in is calming your body, your mind. Breathe out. Put a gentle smile on your face, and let's go ahead. The next technique is something called sober breathing technique, where it's similar to what we did about 30 seconds back. We can stop with whatever work we are doing. We can observe what is happening inside our body. We breathe in, breathe out, expand our awareness. And if there is somebody waiting for us, we will respond very mindfully, very respectfully. So this is mindful walking meditation. I think this was there in our ancient sacred texts many thousands of years back. And now we are calling this as grounding, where we are telling, kindly remove your footwear, try to get contact with the ground, try to contact the earth as much as possible, because the earth is full of energy, full of viability. Choose to walk, and while you walk, experience all the pain, all the sensations through your legs, passing to your body, and just walk for the purpose of body and bring the awareness to your entire body. This is called an easiest grounding technique, which requires no app, nothing. You can do it at your will. Whenever feeling anxious, whenever feeling dry, whenever feeling extremely low, extremely challenging, exhausted, we can do this. We have 5 senses. So we start with 5. We can just look around and see 5 things that we can see. 4 things that we can touch. It can be your laptop, it can be your dress, it can be your face, it can be a cold water bottle. 3 things that we can hear. You can hear the AC, you can hear the fan, you can hear somebody whispering outside. 2 things that you can smell, maybe your sweat, maybe some perfume. And 1 thing, sometimes we may not have something to taste. We can just imagine the taste of whatever tasty dish that you like. And this is called grounding because you are using all your 5 senses, Aimbulangal, to see what's around. And this is bringing in awareness. This is grounding you to the reality. You might have been in reality with a patient about 10 minutes back, talking about his or her sickness, and then 15 minutes, 20 minutes. And then once the patient moves out, before another patient comes, you can take 20 to 30 seconds, do this 5, 4, 3, 2, 1. And eventually, over a period of time, you will be ready, available to respond rather than to react. So stop technique, again, like I said, stop what you're doing, take a breath, observe small changes in your body, thoughts and emotions, and proceed with whatever you're doing. So this is the box breathing that I was telling. Box breathing is one where, it says hold, inhale for 4 counts, hold for 4 counts. The counts can be as less as 2 for beginner. So just inhale for 2 counts, hold for 2 counts, exhale for 2 counts, hold for 2 counts, and then the box, if you can club the box, say for about a minute. Generally, breathing technique, pranayama, the most commonest word that we hear. This pranayama is related to our thoughts, because if we are able to slow down our breathing, we know when we are anxious, we are, hungry for breath. Our heartbeat is fast, then our respiratory rate is fast. As medical professionals, we know it very well. So when we are able to do a controlled breathing technique, which is called a square breathing or a box breathing, our thoughts also, instead of flooding, it will slow down at a pace, and we can think clearly and choose to respond to whom. So thinking clearly means that our filter is good, that our thalamus is good, and it is not reacting but responding. So this is the loving kindness meditation which IMA has as its prayer. Many thanks to to whomever has designed that prayer. It is very, very essential. I hope we can repeat this second page to ourselves. May I be happy. May I be well. May I be healthy. May I be safe. May I be loved. And the same for anyone whom you love, or it can be as simple as may the universe be happy. May the universe be well. May the universe be healthy. May the universe be safe, and may the universe be loved, because we are a part of this continuum called the universe. And so universal happiness will reflect in us. Mindfulness in various settings, especially for us as healthcare providers, whether it is us, our nurses, or our entire team, it has clearly shown that mindfulness helps in reducing depression and burnout. Burnout is the most common among doctors. I'm sure we all are aware of it. So practicing these mindfulness techniques, even 1 minute a day, can make a difference. In schools, we are spreading this information. During break time, you can take a break while you are waiting in the restroom queue. You can just have a quick breathing technique for you to do. Books, which I'll probably leave this for IMA to read if they have time. Websites. These are apps. See, now I think this is a very tech-savvy world. So younger generation is like, okay, so if I have to drink water, I have to remember myself. The app says, okay, this is time to drink water. So because we are all using apps, there are so many apps. Few of them are free, few of them have a subscription model. And these are very self-help apps which can help us teach mindfulness. This is for all of you. Sometimes I forget to thank the people who make my life happy in so many ways. Sometimes I forget to tell them how much I really do appreciate them for being an important part of my life. Thank you, all of you, for being here with me. Thank you very much.
That was a very wonderful and excellent presentation, Dr. Sweta Raghavan. Probably Dr. Sweta had reduced the stress level of all the listeners, delegates, It was a very wonderful mindfulness experience, which you had taught the various techniques. And to share a few points from my side, almost Dr. Sweta has covered all the stress factors in various age groups, childhood, adolescence, and workplace stressors, and the geriatric groups. Everything she has covered, and especially in the resilience slide was very wonderful, and how resilient you should be. Highly spotted the resilient condition, that is the positive emotions to be brought out, and one should be aware of self. Inner awareness very important, and the emotional regulations and the positive thinking, the flexible thinking. So one has to have a flexible thought to have a resilient mood, control everything. And about the mindfulness, you have explained very beautifully the various methods and techniques. It is really wonderful. If any patient from my side asks for any kind of therapy in future, I'm going to send to Dr. Sweta Raghavan. Then to add a few more points, like I wanted to specifically highlight the problems prevailing in children and adolescent age group. Like when sleep is one of the core pillars of health, the children and adolescent who are staying up late at night, scrolling, studying, gaming, and on digital exposure, they have high levels of stressors, anxiety. Thereby, they develop depression and stressors, and they lose their normal regulation of sleep cycle. And why we are repeatedly talking about the children again and again, children and adolescent behavior problem? Because we get to a more number of cases in our way, OP, with children coming with behavior problems. Like a behavior problem is not very simple. It's so strange getting a violent behavior in an 8-year-old, 11-year-old children, very violent, assaulting mothers, abusing in filthy language, very, very common. Day by day, the number of OP patients getting increased among the children. This, I wanted to make a specific mention about it. And the children, not only simple lying, stealing, they cross the limit of getting themselves into antisocial activities and getting themselves involving in criminal offenses. And this very disheartening situation now we come across. We really did not know. We empathize the parents. Really, we have to cut a sorry figure for the parents. Then coming to the interpersonal problems, very common, like a small sibling rivalry, conflict between the siblings, elders or younger ones, or interpersonal problem with the family members. All these, initially they had just an adjustment problem, and now they land up in committing a suicide, just for simple reasons. So mere excuse like what we get from the parents, just father scolded, he attempted for a hanging. And mother scolded, she consumed a poison, either whatever is available at house, or pig, or all out, or very easily available rat killer. So daily we do get nearly 50 to 20 number of cases from the medical departments, and we need to assess them. And many have underlying depression, anxiety, stressors, and there are children who have a disrupted family with single parent, or mother eloped with the other person, and father couldn't run or bring up the child, financial problem. Like this, so many stressors children are undergoing. And also there is a decline in the scholastic performance. So altogether, children, we do get a number of cases, and what Sweta has said, she has covered all that. And for this, I particularly make a mention about the parents. So they play a crucial role in focus their attention on the children's body language daily. They have to sit, even working women parents, they must sit and talk with the children, and they share, they should listen to their problems first of all. And they have to stress their, reduce their stress level, and should have a very congenial, comfortable talk with the children, so that this can be prevented, or it can be brought to the professionals. And likewise, similarly, she had told about the pressure at the workplace, So how, I mean, overloaded with work, too much work, and I mean, burnt out in physical condition, leading to mental exhaustion and leading to so many other anxiety, depression, and psychiatric problems. And the same conditions prevailing in above 50 years age group. So we have seen above 50 years age group, there is neurological and psychological changes that take place. There is improvement in wisdom and as well as emotional control alongside. And at the same time, there is a decline in the certain types of brain function, like memory and the processing speed, for example, in Parkinsonism, like conditions, etc. And there are also mental health risks, like social isolation in the retirement life, or death of a loved ones, leading to bereavement, or decline in the physical health, like a person suffering from chronic ailments like renal failure, etc. So all these people do develop, or there is a comorbid anxiety, depression in these medical conditions also, which need to be attended. So I want to be specifically make a mention on the caretakers. So whoever brings either the children or the spouse should attend to their problem and should be brought early so that this can be prevented. And finally, as she told about the resilience slide, I want to make a mention about the emotional quotient. See, many are highly intellectual, brilliant, genius with IQ more than 120, 130 like that. And they just excel in their business. But how many of them have a emotional quotient, normal balance in their lifestyle? So for that, one should have a normal emotional intelligence, including the self, which takes care of the self, empathy, social skills, ability. A person who is success in school depends on his IQ level, whereas a person's EQ level, that is emotional quotient, reflects his success in real life. So a person with good emotional quotient can recognize, control, and express one's own emotions. Along with that, they can assess others' emotions on the contrary. And a person with high IQ can learn, understand, and implement knowledge. So high emotional intelligence can be seen in leaders, captains, managers, people, and so on. So one should have a balanced emotional quotient along with the intelligence quotient. And with that, I conclude. And I leave it to the audiences. Any questions from the audience side? You can raise
Madam, Madam Dr. Sundaramurthy, pulmonologist, Chennai. Madam,
yes, sir.
am I audible?
Yes, sir. Yes, sir. You are audible.
Okay. Only one basic question regarding the legal issues in mentally disordered person regarding the marriage and divorce. Is it still practiced or wiped off?
What is it? Sir, can you please be louder, sir?
Yes, madam. Regarding the legal issues in mental disorder patient, legal issue like divorce or not
Yes,
to get married. Legal issues, madam.
Yes, sir.
I
think even Sweta can answer this question.
Sir, legal issues, the mental illness now is classified into major mental illness and small mental illness. So it is different for different groups of mental illness, sir. A person who is anxious cannot get married. Andamari rules eல்லாம் கிடையாது. Even with major mental illness, the families are told that we choose to disclose that this person has a mental health issue and he or she is on medication, and then go ahead. If they hide the information and then later the family comes to know, then a major mental illness like schizophrenia or bipolar disorder, if was present before the time of marriage, then it is a legal ground for divorce.
Okay. Only a general question, madam, regarding the outcome of treatment for mental disorders in male and female. Which is the best to overcome? Is it male or female? Outcome is better.
Gender-wise outcome doesn't vary, sir. The duration of untreated condition only determines the outcome. It is not majorly gender-based. If depression, sir.
Then generally they say female outcome is very low compared to male.
No,
Is it
sir,
true?
not that. I am not sure, sir. At least in my limited practice of 15 years, there is no such ideas. There is no such
Fine,
thing.
madam. Fine, fine. Thank you. God bless you.
Thank you, sir.
Points. It depends on the intensity, condition of the people. The earlier they present their condition, the better will be the prognosis. They come late, then they'll have to continue their treatment, follow up regularly, and there should be the enough family support, sir. Family support, care. If it is adequate, definitely to some extent we can see the improvement. Yes, sir.
Sir, ma'am, there is a question on how to handle mobile addiction. Sir, mobile addiction is under a category called behavioral addiction, sir. It's a whole treatment process in itself, depending on first the assessments are there, where we see how severe the addiction is. Then each treatment protocol is custom made, sir, based on how much time they spend, what are they spending on. So cell phone addiction can be from gambling to pornography to so many other websites which are available. So there is no one standard SOP that is done. It is all custom made based on the assessments for the individual person, and it takes a long time, sir. A lot of commitment required both from the person along with the family. Like madam said, mental health issues are a condition where it is not only dependent on the individual. More so, the family caregiver burden is the worst thing. The person who experiences the mental health issues, of course, has certain concerns, but for the family, it is a big burden. So if the family is more supportive, then see, if I'm telling my child that you don't use cell phone and I'm using WhatsApp, then what standard am I setting? So once it is a mobile addiction, then we call the entire family as a unit, family or friends whom the person lives with. So it's a long drawn process. It is not a single event where I say, okay, I give a drug. There is no drug-based recovery for behavioral addiction, sir. It's a inpatient schedule usually, or weekly meetings that we do, and it takes a long time.
Shweta madam.
Sir?
The proportion of suicidal tendencies among doctors is increasing.
Yes.
So what is the major factors for that? What barriers? What is the barrier? Why they are not seeking help? What is the what is your
barrier is with psychiatry itself, sir. Psychiatry itself has a stigma. Can you, in your medical college, visit a psychiatry department from a different department for your own mental health? Can I choose to disclose? Somebody seeing me going into the psychiatric department, I will go and say, I am friend of Patran. I am not going to tell that I am seeking some help. So the first thing is stigma among our own professionals. Fearing, are they going to assess me? So people choose to go out. Okay, I will not do in my medical college or my place of practice because somebody will come to know. We are associating mental illness with weakness of mind. There is no concept of weakness of mind or strong mind. Anybody can fall a prey to depression like malaria. If mosquito bites, malaria will come if my immunity is low. In the same way, if my immunity is low, or if my situations, my family situation, my family support is not good, and I have extreme burnout workload, then I am also subject to burnout. So the same skin and bones which another patient is made of, I am made of. First, that I have to accept. That acceptance is very poor among doctors, sir. The doctors can also have mental health issues. That acceptance is very poor. There is a lot of stigma amongst our own professionals. And then even if they seek help and we tell, look, sir, this is major mental health issue. You need to take medications. There is a barrier about medications. Saying, okay, if somebody starts a mental health medication, it is lifelong. No, I am sorry, it is not. It is not a lifelong medication. There are so many people who are off medications depending upon the type of illness. And mental illness, majorly like diabetes and hypertension, is a lifestyle disorder primarily. So we need to make lifestyle changes along with medications, along with therapy. That is the major barrier among doctors, is fear of being ridiculed by their own colleagues. Fear of being rejected. What will they think if but they end up giving their lives. I have lost my own colleague very recently to suicide about 3 weeks back. And this person is a very, very cheerful person. No, like what we see externally is not what is happening internally. I might project myself as a very, happy, positive person, and then I end my life behind because of so many other reasons. So choosing to discuss, you don't have to go to a mental health professional. Even you have a accountability buddy in Solo. Go talk to a colleague. Let us be non-judgmental species. Hey, somebody wants to talk something to you, let's be non-judgmental. Let's just listen. But if you think if it is beyond your purview, hey, looks like this is serious, why don't you have a discussion with a proper professional? That we all can tell, sir. We don't have to have a psychiatry degree to tell, okay, looks beyond my purview. I think we all can do that. We all can be accountability buddies for each other, where people can share without barriers. Or now we have in medical colleges, especially in Chengalpattu Medical College, there is an anonymous thing. You go, you let out your feelings. You don't know who is listening to you. This is like in churches, they used to have these boxes, sir, where fathers, pastors will sit. They go let out their feelings and come. Something is fine. Go let out. You can be anonymous. You can call anonymously. There are so many helplines. Call anonymously, get some help. Because the helpline person is usually a mental health care provider. And if they feel this is intense, go reach out to a mental health psychiatrist, please reach out. We are always there. And our specialty, I'm very, very clear, we are not judgmental. We are not going to talk to other professional. Confidentiality will be 100% maintained. Not even to your spouse, unless there is a risk of self-harm.
Yes, madam. Do you suggest any role of work environment and policy and any designated working hours for the doctors to prevent this type of
Definitely. Burnout is the
tendencies?
first common reason.
Yeah,
So
yeah.
I think when you and me were doing interns, I think we have all done 24 into weekly. Now I think UGs are fighting and they won't do more than 36 hours. They have a lot of benefits. I in fact appreciate that you don't burn out, you do 24 hours 1 week. So let's have logical limitations. Let's have post-duty offs. If the doctor is not coming for 2-3 days, let's have a call. Let there be some specialist who can say, hey, what happened? You are absent for 3 days continuously and there is no intimation. I have lost one senior doctor like this. One very senior practitioner who didn't turn up for 3 days and then he is found dead in the house, in his own room. Nobody even called that person. And at the end of 3 days, half his body has already putrefied. It is very pathetic. Our own colleagues, sir, what are we doing to ourselves? We are very resourceful. In fact, we are not just, we are qualified. We are used the resources of public only, but we should also take care of ourselves. So that is why I said, be selfish sometimes. Please reach out for help. We are willing. It need not be a psychiatrist. It can be your best buddy, but just talk to somebody. Just talk.
Yes, madam. Kindly give your inputs in the designated manner to the IMA so that we can tell to the government to reduce the working hours. What are all the working environment?
We have applied from Tamil Nadu Psychiatry Institute. We have applied for the stipulated working hours to have these anonymous calls. We have applied to the government, but of course there are certain limitations which the government has. So let us see if it comes into policy levels. But as for me, I can again put my number in the chat box. I will be available for our professionals.
Yes, ma'am. Madam, one more question. It is related to the astrology. Do the Amavasai moon and the Paurnami moon have any effect over the mind changes?
See, as for me, I will say yes, because over the period of 14-15 years, we have seen, I worked with Madras Medical College, Institute of Mental Health. So, if Amavasai Paurnami comes as an intern, we are afraid because we have seen that some specific patients will become violent. And over the period of years, when I read literature, I found out, see, like nature, that is the world, it has 70% water and 30% land. Our body also has 70% water and 30% land. And this Amavasai Paurnami brings about changes in the deep oceanic level. So in the same way, when there are oceanic changes, since we are a continuum of the universe, it is very possible that there can be changes in our water influx and outflux, which can bring about mood changes. There has been one paper which was published by one of the senior consultants on this, and it was published also, sir.
Yes, madam. I think this factor, whether do you think it influenced the working environment of the doctors?
Which one, sir?
This changes in the planet and also the changes in the environment, is correlated?
Possible, sir. No, about planetary changes, I am not sure, but since it is all universe and it is connected, it should have, sir. Energy levels change. As women, we can say we are observing changes with our menstrual cycles. That is why we were given 3 days leave previously. by our forefathers saying, you take rest, man, at least for 1 month. It was not isolation. The intention was never isolation. The intention was your body is highly energetic during those times. At least for 3 days of the month, you relax. Because back then, women were doing only household chores, mainly cooking and cleaning. So they allowed that menstrual rest for the time because we were assumed to have high energy levels. That's கோட்பாடு நிறைய இருக்கு booksல. Maybe planetary changes will also have, sir. Studies, I am not sure.
Okay, madam. Thank you. Sir, Secretary, sir.
Yes, sir.
Chairman, sir. Yes, sir. I think we can.
Shall we conclude, sir?
Yes, sir.
Good evening. Good evening. We had a wonderful session. First is HPV vaccine kind of workshop kind of thing. I thank the speakers, Sebastian, Sabana ma'am, and Mega ma'am, and the moderator, Dr. Sujata ma'am, for the wonderful views about the HPV vaccinations, indications, so what kind of dosages, etc., in detail. So thank you very much for this wonderful session. And second session, really awesome. Dr. Sweta ma'am, really crisp and clarity presentation on mindfulness and anxiety and the role of meditation, sleep hygiene, a lot of take-home messages. So really wonderful. Thank you very much, Sweta ma'am, for your crisp and clarity presentation. And I thank the moderator, Dr. Maithili ma'am, for the wonderful opening remarks and closing remarks for your World Mental Health Day. A lot of take-home messages we have learned. So we have to be selfish. Ourselves, we have to take care of our health is the first one. So then only we have to take care of others. The selfishness is very, very important. So Madam Sweta told clearly about all kinds of illnesses and other things and all. So today we learned a lot of things about the lot of take-home messages. I thank you all the delegates for your wonderful participation. I thank you the technical team and IME leaders for the wonderful platform to disseminate the knowledge across the so not only our state in pan-India level. So I thank you all once again. We'll meet again next month with a very good topic. So thank you all. Long live IMA. Thank you very much.